सिंपल फोटो है, 4 बुक के बराबर एक नोट, इतना भारी पड़ता है नोट, सबको पैसा अच्छा लगता है. एंड एज वी ऑल नो, सैडली इन इंडिया, time devoted in clinical practice will yield at least 2 to 5 times more remuneration versus time invested in academics. And that is the truth of India. And I love money. Everybody loves money. But in the end, when we see, we also have a time and we want to see what is our life, what is the purpose of our life. Obviously, one of them is wealth creation. It is there. But then there are other motives also, like intellectual growth. And we all want to constantly evolve as an ophthalmic practitioner. We all want to be scientifically updated, and we want to contribute to the real science and to our ophthalmic fraternity. In order to intellectually stimulate ourselves, clinically evolve and update, and contribute to the eye science, you have to develop a partnership with the academics. There is a term, publish or perish, and it's like a fear mongering. Is it a warning against an academic career? Is research a burden? Well, academia and private practice are not mutually exclusive environment. A spectrum of clinical care, teaching, and research can exist to varying degree in any practice setting. What really matters is how much of each of these activities a fellow desires to have in his or her career, both in the short and long term. An advantage to the private practice setting is that one often has more latitude in choosing how much time one wishes to put into teaching and research. However, research activities might be limited in a busy clinical care setting. There is a lack of protected research time in typical work week. There is a lack of infrastructure support permitting doing certain type of research. Universities are far more likely to have institutional research boards, statisticians, data analysis, animal laboratories, and other resources. But to defy everything, well, some of our greatest innovators have been private practitioners, and that is the way to go. Ultimately, there is no clear map for an individual who is considering a switch from academic to private practice or vice versa. One needs to self-evaluate the specific environment at a given site and determine for him or herself whether the trade-offs between academia and private practice are worth it. And to conclude, in the end, when we all, we have an 80-year, 100 years of lifespan, we all want to leave a mark here, that we were here at this beautiful planet Earth. And there is no better way to leave your footmarks in ophthalmology eternally than academia. Publish and be remembered forever that you were there. Thank you.
Thank you, Dr. Abhishek.
Excellent presentation.
Very nice.